to memorize relation of thoracic duct. For that you have to listen a story. There was a skeleton. He had tons of a skull. He opened a shop of a skull in main market and displayed in a beautiful manner. Now he is a millionaire. He is too busy and missing his early days. Tarun Datta, in his early days, he was a right-handed batsman. His batting skill was so good that everyone used to tell him unpaired or matchless. He always wore jersey number 12. His girlfriend always stood on left side and cheered him. There was some misunderstanding in between the skeleton and his girlfriend, and now he is very lonely at night. When he returned home, his dadi, grandmother, used to open the door and serve his favorite food, bagan ka bharta. Even though he is so talented and unpaired, he never forget to worship God, that is Data. Tarun tried much, but he failed to forget his girlfriend. So he shifted his workplace from India to San Marino. Now all is well. He made his life very comfortable. Tarun is very foodie in nature, and very few people know that he is asthmatic and take inhaler. Lastly, he entered into his own cafe nearby his girlfriend's cafe in Visakhapatnam. So this is the story, and Tarun Datta is nobody else but the thoracic duct. And thoracic duct relation is described in 4 places, that in aortic hiatus, here in the posterior mediastinum, superior mediastinum, and at the root of neck. Aortic hiatus is synonymous with the early life. Posterior mediastinum, that is in PM, returning from office. Superior mediastinum, Tarun's life in San Marino, and at the root of neck symbolizes the death of Tarun Datta. Now first come to relation of thoracic duct in aortic hiatus. Look, this is aortic hiatus. Here in green color, this is thoracic duct. So anterior to thoracic duct is the median arcuate ligament. This is median arcuate ligament. Here is the medial and this is lateral. But median arcuate ligament, this lies anterior to the thoracic duct. Take initial of all this, that is MAL. Mal. Mal means money. Tarun has plenty of money from his early life. In the right side, in aortic hiatus, right of the thoracic duct lies azygous vein. The literal meaning of azygous is unpaired. That Tarun has unpaired batting skill and he is a right-handed batsman. So on the right side, his unpaired batting skill, that is azygous vein. In the left side, in the aortic hiatus, thoracic duct, in the left side is related to aorta. Aorta, in Hindi it sounds like aurat. That means lady. Tarun girlfriend always stand on the left side. So in the left side there will be aorta. And posteriorly, Tarun always wore jersey number 12. And the number 12 is written on the posterior aspect of the jersey. So posteriorly there is T12 vertebra. And it is better explained in this picture. Here is thoracic duct or Tarun Datta. In the right side, his batting skill, that is unpaired, so azygous vein. In the left side, his girlfriend, we always stand on the left side, aurat, that is lady. Anteriorly, plenty of money, that is mal, median arcuate ligament, and posteriorly, jersey number 12, that is T12 thoracic vertebra. Now come to second relation, that thoracic duct in the posterior mediastinum. Always welcomed by Dadi at the door. So Dadi lies anteriorly, diaphragm, descending thoracic aorta and esophagus. Here it lies in the posterior mediastinum. So anterior to which is diaphragm. This is descending thoracic aorta and here lies esophagus. Posteriorly, there is bharta. In absence of Tarun Datta, Dadi prepare bagan ka bharta. So bharta lies posteriorly. That B for vertebral column. Here lies vertebral column. And in this picture, you can see bharta, right? That is right posterior intercostal artery. These are all right posterior intercostal arteries, which are the branches of descending thoracic aorta. T for terminal part of azagus and hemiazagus. Terminal part of hemiazagus and accessory hemiazagus. We all know at T8 level, accessory hemiazagus and the hemiazagus vein opens into the azagus vein. So terminal part. And A for anterior longitudinal ligament, which lies on the anterior aspect of the vertebral column. And it is better explained in this picture that on the right side, his batting skill, which is unpaired, that is azagus vein. On the left side, aurat, that is lady, aorta. Anteriorly dadi, that is diaphragm, descending thoracic aorta, and E for esophagus, DDE. Now, posteriorly there is bharta, bagan ka bharta, that is vertebral column. R for right posterior intercostal artery, T for terminal part of hemiazagus and accessory hemiazagus vein, and A for anterior longitudinal ligament. Now coming to relation of thoracic duct in the superior mediastinum. Here is superior mediastinum and Assam, so San Marino. All is well. That anterior to the thoracic duct is the arch of aorta and the left subclavian artery. Here is the left subclavian artery, anterior arch of aorta and the left subclavian. And posteriorly, we all know that this is the vertebral column. So posteriorly, he dwells very comfortable life. And the right side, we can see here, in the right side, this is esophagus. And in the left side, lung and pleura. And it is better explained in this picture that Tarun Datta, that is thoracic duct, all is well, and really all is well, that is AL, arch of aorta and left subclavian artery. Posteriorly, VC, very comfortable life. So vertebral column. In the right side, foodie in nature, a skeleton or a person normally take food by his right hand. So the right side, foodie in nature, esophagus. It signifies esophagus. And in the left side, this is inhaler. It signifies lung and pleura. Now relation of thoracic duct at the root of neck is same as that of when Tarun died. Anteriorly, coffin. He entered into coffin. So C for coffin and C for carotid sheath. And we all know inside the carotid sheath, internal jugular vein, common and internal carotid artery and the vagus nerve. As the thoracic duct crosses right to left at T4 level. So at the root of neck, it is on the left side. So left common carotid and left vagus and the left internal jugular vein. Okay. And posteriorly, he dies in the Visakhapatanam. So posteriorly is the vertebral artery and vein. Vertebral artery, we all know, is the branch of the subclavian artery. Here lies the subclavian artery. So posterior to the thoracic duct, this in green color is the thoracic duct where it opens into the venous angle. So posteriorly there is vertebral artery and vertebral vein. This is a scalene anterior muscle. Here it is written scalene anterior. Okay. So scalene anterior posteriorly, and this one is the phrenic nerve, Visakhapatanam, and the thoracocervical trunk. Here is this is the thoracocervical trunk and its branches. So posteriorly Visakhapatanam. So this is all about the relation of thoracic duct. Better explained in this picture that anteriorly there is coffin, that is carotid sheath, having internal jugular vein, vagus nerve and the common and internal carotid artery, all that of left side, and posteriorly to which is the Visakhapatanam where he dies. So V for vertebral artery and vein, S for scalene anterior muscle, P for phrenic nerve and T for thoracocervical trunk and its branches. So that's all.